Support comes from the Missouri Forest Products Association, honoring Arbor Day on April 26th, with an ongoing commitment to sustainable stewardship and conservation of Missouri's forests. ChooseWood.com.
From St. Louis Public Radio. This is St. Louis on the Air.
I think in this group, what you're seeing is what we would call an in-group, out-group bias. Most of us have multiple in-groups, right? If you're a parent, you might view other parents as an in-group member, other members of your profession, other community members. They see the experts as out-group members. They don't necessarily share their values, their background, their experience, their education.
I'm Sarah Fensky. Last winter, many of us assumed vaccines would be easy. The big question seemed like who would get them first, right? We just assumed everybody was eager to get in line and get their shot. Well, how wrong we were. And with kids newly approved for the Pfizer vaccine, it's worth looking at the lessons from last time around. There are plenty of reasons to be cautious about anything that's brand new. So what can public health officials do to overcome hesitancy as another big population group is now vaccine eligible? Molly Wilson is a professor at St. Louis University School of Law. She has long explored how patterns of human decision-making influence and should influence law and policy. She's recently studied vaccine hesitancy, and she joins us today to discuss what she's learned. So Molly Wilson, welcome.
Thanks so much for having me.
So many parents have a big decision to make right now. Get their kid vaccinated or not. What are some of the different camps you see as parents are sort of deciding how to deal with this issue?
Well, I think, of course, as you mentioned, many parents are very, very eager, myself included. I've been waiting for one of my own kiddos to get their children vaccinated. So that's certainly a significant group, which is great.
So no doubt, let's go do this. That's Group A.
Exactly. And then I think there's another group that is still deciding. And I think we saw this with the adult population making decisions about themselves as well. They have, I would call these vaccine hesitant. It's not that they're opposed, but they want to know more information. They might want to see other people getting vaccinated or having their children get vaccinated to see sort of what the outcomes are. And then I think there's a third group that is sort of reactant against the idea of vaccines and will state that they will never have their children vaccinated. And the latest number that I heard was roughly 30%, which is concerning.
Yeah, that seems like a pretty high number right there.
Yes.
So we know, as far as trying to persuade people to get vaccinated, you don't have to worry about that Group A. They're already in line. They're fighting for those limited appointments. They're getting that done. We have these other two camps. Do you handle these two camps differently?
I think you do. In terms of the first camp, the camp that wants to do what's best for their children in terms of keeping their children healthy, but have some concerns about the vaccine. I think there are certain psychological biases that we see in that group that we can address. So I research biases which are sort of irrational thought patterns and ways of forming attitudes. And I think that particular group, there are specific biases to that group that we can kind of try to address to calm their concerns. With the second group that says never, I will never get my child vaccinated, and probably they are not vaccinated themselves, there's a different set of biases. And so we would call that psychological reactance, which basically is grounded in this idea that they are reacting against a perceived threat to their freedom to make choices. And the more they're pushed to make certain kinds of health choices, the more stubbornly they're going to probably maintain their position.
So with that group that, kind of has their backup, it might not even make sense to try to have this very serious conversation about here's what I think you should do.
That's right. And I think actually this group is most resistant to hearing the messages from the experts. So I actually think that hearing expert opinion, public health experts, epidemiologists talk about this. I actually think that can be counterproductive for that group.
Because they feel like they're being pushed.
They feel like they're being pushed. They feel like experts perceive themselves as sources of authority, which can cause more entrenchment and a greater amount of reactance.
I mean, aren't experts sources of authority? That's what makes them experts.
Well, I would agree with you. However, I think in this group, what you're seeing is sort of what we would call sort of an in-group, out-group bias. Mm-hmm. So we all have, most of us have multiple in-groups, right? If you're a parent, you might view other parents as an in-group member. If you're a professional, other members of your profession as an in-group member. In your community, other community members are in-group members. And so for many people, I think, who are reacting against this push, strong encouragement to get children vaccinated, they see the experts as out-group members.
Okay.
They don't necessarily share their values, their background, their experience, their education. So I think in that situation, that can actually create even more reactance.
That actually explains a lot to me as I'm thinking about this past year. Let's go to this group of people who are hesitant. You know, they want to do the right thing. They're kind of feeling things out. This seems like the group that might be ripe for the picking if you're a public health professional. What can be done that's persuasive to them?
Well, I think the first thing is to understand where the hesitancy is coming from. Mm-hmm. So as an initial matter, there's lots of data to show that things that are novel, new, unfamiliar, and uncommon cause fear, right? So even novel therapies and treatments that seem really promising because they seem from all the data like they have really important beneficial effects, can be concerning to people who don't have experience in maybe how a vaccine is developed, how it works in the body. Most of us don't understand that. So even though it seems like there's overwhelming evidence that it could be very positive, this group feels like it's unknown. They don't understand it, and therefore they feel fearful about it.
I mean, that makes sense. And, you know, there's been a long history of for every medical advance, there are sometimes big steps back. Things go wrong. You know, there's a core of rationality there. And yet, you know, we're coming out of something that has been tested and the kids in this testing group did so well. So knowing that this is where that group is coming from psychologically, how do you begin to talk to them about something like this?
Yeah, I mean, I would agree. First of all, there's an adaptive, just sort of evolutionarily adaptive aspect to this, right? I mean, our ancient ancestors, if they just ran around eating new things that they didn't have any experience with, you know, they would get really sick and sometimes they would probably die. So new things, being fearful and hesitant about new things is not totally irrational. But I think that getting information to people is really important. That's something we've definitely seen. I think it's also about how you frame the question. So things are new. They seem risky to begin with. Explaining that we now have a lot of data is really important. And then flipping it around and framing the question or the decision about risk in terms of not getting the vaccine, I think can be really helpful. So there's been a lot of focus on the vaccine and talking about how low the risk is, efficacy and low risk of side effects. But I think it would be helpful to frame the problem in terms of the risk is about not getting vaccinated, right? So that the really risky decision is foregoing the vaccine.
And so if I'm a risk-averse person, I'm not the ancestor who's running around plucking up new foods. It's like, wait a minute, it's more dangerous to stay here and stay put than it is to try this new thing.
That's right. And there's another sort of psychological bias that's very robust. There's lots of data on it called the status quo bias. So when people are in a situation of uncertainty and they see two risky situations, the one that would require them to take action is usually the one they're more fearful of.
I get that.
Right. And so it feels intuitively right, but it's really, really problematic in a situation where what we need people to do in order to lower their risk is to take action and take specific steps to do something to protect themselves and their children. Yeah,
so what do you do in that case if somebody's almost just frozen a little bit?
Well, I think you can do some things that we've seen work in other situations. For example, companies have long been concerned about the fact that people don't save enough for retirement. And so there's been an effort to put people into opt-out situations. So you opt, as soon as they get employment, they come into a position, you put them in a retirement savings account, and they have to opt out of it. I think there's an opportunity to do some clever things with maybe things that we, as far as I know, we haven't tried yet, some creative solutions. Like, for example, maybe giving children appointments for vaccines and having the parents opt out if they would prefer not to have their child vaccinated.
It feels like that could really backfire with somebody who's in this third group who is mad and they feel pushed. But for somebody who's in this hesitant group, that could sort of force them. They'd have to proactively stop this train that's kind of moving.
Yeah, that's right. And this sounds a little bit crazy, but I think parents, if you ask a lot of parents, they would rather make a bad decision for themselves than for their children, right? There's this sense that, at all costs, you should protect your children, which is really great. But I think no parent wants to be the agent that puts their child in a risky situation. However, if we have schools, which have long been places that parents have trusted, that their child will be well cared for and will have a good experience. If we have the schools implementing this program and then the parents have to actively opt out, right? I think that will sort of change the way parents think about that risk choice.
It's interesting. I feel like my pediatrician kind of does this already. Like they'll be like, hey, your kid is turning 2. They're scheduled to get this and that. And of course you can say no, but it's kind of like this is on the schedule. And so this would just be a way of doing this for older kids, maybe through a school district.
Yeah, that's right. I mean, I was thinking about the example, too, of you go to your doctor or your dentist, and when you leave, they often want to sign you up for your next checkup, right? It's like, and then you've got a call to cancel it if you're not going to come in.
It's right there on your calendar. You kind of end up just going for it.
That's right.
Well, we're curious to hear if you're dealing with somebody who's vaccine hesitant. What advice might be useful for you? Tell us a little bit about your scenario. Our phone lines are open at 314-382-8255. That's 382-TALK. You can also send us a tweet at STL on air. We heard from ML, who writes, any tips on how to counteract the avalanche of misinformation that folks receive via Facebook's algorithm, which doesn't care if you're getting the truth so long as you spend more time on Facebook? Kind of a good point there embedded in that question.
Yeah, and that actually brings up another point, which is that people make decisions based upon what is social psychologists and cognitive psychologists say cognitively available. So that's just a way of expressing the idea that when you're making a decision about what's risky, you think of examples. And the example that comes to your head first is usually the one that you go with, right? So the classic example is if you ask somebody how risky it is to fly in a commercial airplane, they vastly overestimate the risk involved with that. It's not that they think it's terribly risky, but they're still overestimating the risk. And so researchers have explained that by saying everybody remembers hearing about a commercial plane crash. It's incredibly salient, very vivid, horrifying. And so because it comes into your mind more quickly than it really should have based on, the real world incident of that kind of plane crash, you overestimate, you overweight it. I think that's what's happening now with some of this misinformation, especially since some of it is so disturbing, right? But that doesn't make it accurate. It just makes it memorable and sort of horrifying. So things like the vaccine rearranges your DNA or causes skin lesions or all sorts of things that are just patently untrue. But they're so vivid and memorable that people think of them. If we can replace those sort of thoughts with other thoughts that are positive, like examples of vaccine drives that have been really positive, where hundreds of people have been vaccinated, situations where people have been at high risk, maybe exposed to COVID, but because they're vaccinated, they don't develop serious symptoms. If we can replace the misinformation with positive, good information, especially depicting it in really vivid and memorable ways through narratives, perhaps, that might be one helpful strategy.
We're talking today to Molly Wilson. She's a professor at the St. Louis University School of Law. She's studied vaccine hesitancy, has some great tips here on how to deal with this and what public health officials could be doing, what we could be doing. I'm going to go to the phone lines. Dr. Ken Haller is calling us. Dr. Haller, hi. You're on St. Louis on the Air.
Hi, Sarah. I just wanted to thank Dr. Wilson for her comments today. Sarah, when I heard this about vaccine hesitancy, I had to call in.
Of course, I know that's your topic.
Yeah, I think everything you're saying is really excellent. The one thing I would add is that as a pediatrician on the front lines, to start that conversation with a hesitant parent, validating the emotion is really important. If I can say to them, I can see you're scared. This is very scary. I've heard these scary things too. This shows me how much you love your child. That really gets the conversation going and shows them that I'm taking their concerns seriously, and then we can move forward with with the facts.
Molly, is that maybe a way to keep somebody who's in that second group where they're on the fence from moving into that third group where they have their backup and they feel like people are attacking them, to sort of come in with that good bedside manner that the good doctor has?
Yeah, absolutely. And that's where I think pediatricians can play such an important role to humanize the situation, not to take a sort of authoritarian approach. Sharing personal stories. Many pediatricians are parents themselves if they have school-age children, to say, I get it. And like you, I want to do the best that I can for my children to keep them safe. And this is why I made the decision to vaccinate my children, and getting others involved as well. Just sort of, if there are people who have a connection with individuals and share similar situations and can say, I went through this decision process, it was hard for me too, this is why I decided to go ahead with a vaccine.
Dr. Haller, are you seeing at this point that your parents are pretty excited about enlisting their kids, or are you feeling more of that hesitancy?
I'm seeing a little bit of both. Actually, I've had a lot of parents who have been really eager to get this vaccine, they're for the 5 to 12-year-olds, and we've had a lot of teenagers who've gotten vaccinated. On the other hand, as Professor Wilson was saying, I've had some parents who have said, I just don't want to hear about it. I don't want to talk about it. But as she mentioned earlier, these are people who are already in that group, that I never will do that group. And in terms of just sort of general vaccine denial, about 2 to 3% of parents, they're just not ever going to do it, and I just move on from there. But there is that movable group, that larger movable group, that if I can acknowledge that the emotions are real, even if I feel that the facts they're based on are completely non-existent, if I can acknowledge the reality and the validity of those emotions, then we can move toward the facts.
Dr. Haller, thank you for sharing that perspective. It's great to hear from somebody on the front lines dealing with this. So, Molly Wilson, with what you've studied and what you know about this now, if I'm a parent and my best friend is a parent and they're on the fence, what would be your recommendation of how to have that conversation where I can actually do it in an effective way and not push her into something that would be bad?
Yeah, I think, again, not coming off as being in any way sort of superior or overbearing about it, not being judgmental. I think that is incredibly important. Understanding and acknowledging, as the doctor said, that this is a process, that parents are being thoughtful about it, and the fact that a parent is being thoughtful about it does not mean that the parent is a bad parent. It means that the parent is a good parent. And then I think one strategy, sort of to circle back to what we started with, was this unfamiliarity is often where the fear starts. And so just anecdotally, in talking to some parents who have had concerns about getting vaccines for their children, I've tried to equate it to other vaccinations that parents are very used to getting, right? Just routinely accept. And at the very beginning of the pandemic, it was not like those vaccines, in the sense that we didn't have as much information, we hadn't had testing and approval, but now we have it. And so trying to normalize the COVID vaccine by equating it with something that's familiar and comfortable and sort of routine for parents, I think can be really helpful.
So those seem like very helpful tips, but, I've only got maybe a couple people in my life who listen to me. What would you say to public health officials? I mean, it feels like there were a lot of missed opportunities last time around. If you were in charge of all this, I don't know that there is any one person in charge of all this, but what's something that you would do on, the bigger picture here?
Yeah, again, I think the messaging is really important. I think hearing public health officials sort of getting help, soliciting help from other folks in the community can be really helpful. Bringing the vaccine into places that are familiar for people. Obviously, we want to remove barriers, but to go even a step further, and bringing the vaccine into school buildings and making those opportunities available, bringing it into where pastors, rabbis, priests are willing, bringing it into places of worship, I think is really helpful. And I think it's helpful for multiple reasons. I think not only does it make it much easier to access the vaccine, but it also provides an opportunity for, again, people to see members of their important in-group, right? Parents who send their children to the same schools, people who worship in the same places, going ahead and getting those vaccines for themselves and for their children. And I think that can be incredibly persuasive.
At that point, you don't feel like you're out on a limb. You're there doing what other good parents do.
Yeah, that's right. And psychologists often talk about herd behavior and groupthink, and it's usually used in a negative way. But I think that it can have positive effects as well, right? If something becomes sort of a social norm, most people in whatever your important in-group that you identify with is doing something, particularly with respect to protecting children, I think that can be really compelling.
Well, there's a lot here that I think is important for people to think about, and I hope that the people who are handling this rollout are paying attention to this advice. Molly Wilson, I want to thank you so much for joining us.
Thank you so much for having me.
This episode was produced by Evie Hemphill, with audio engineering by Aaron Dorr and production assistance from Jane Mather-Glass. This podcast was mixed and edited by Aaron. Our executive producer is Alex Hoyer. St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thanks.
St. Louis Public Radio is a member-supported service of the University of Missouri, St. Louis.
Support comes from the Missouri Forest Products Association, honoring Arbor Day on April 26th, with an ongoing commitment to sustainable stewardship and conservation of Missouri's forests. ChooseWood.com.